to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID.
What I miss is being out there, coming through the gate and getting ready to play. I miss the noise that Rider fans bring. If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season and we need you in the stadium.
If you ever had to look a child in the eye that's relying on you to protect them, would you say, yes, I will protect you? And that's essentially it. I will get the vaccine, I will protect you because you can't protect yourself. Because I will do anything at all costs to protect my daughter.
Getting the COVID-19 vaccine.
We'll have Health Minister Paul Merriman, Saskatchewan's Chief Medical Health Officer Dr. Shahab, SHA CEO Scott Livingston, and SHA Emergency Operations Center Commander Derek Miller. Minister?
Thank you very much. Good afternoon, and thank you for joining us. Saskatchewan's nation-leading vaccination program continues to make incredible progress. Today, we want to let everyone know the next step about second doses, and also how we will be vaccinating our youth. Now that Health Canada has approved Pfizer vaccine for the age of 12 and older. First, for a quick update on where we are. As of today, everyone 35 years and older is eligible to receive their first shot, except in the far north, where we will now be vaccinating every adult 18 and older. More than 480,000 shots have now gone into the arms of Saskatchewan's people. On a per capita basis, that's more than 40,000 shots per 100,000 people, which is the highest vaccination rate of any province in Canada. We're also very close to reaching our first threshold on our three-step reopening roadmap, which is 70% of everyone age 40 and over receiving their first dose. As of today, we are at 68%. While the reopening thresholds are important milestones to reach, as Dr. Shahab said Tuesday, we need to keep going and get our uptake numbers even higher, hopefully into the 80s, like the uptake has been within our seniors. And then everyone needs to go back and get their second dose, which is what we're going to talk about here today. Second doses will start to being offered on May 17th. As of that day, anyone who is 85 years and older or anyone who received their first shot before February 15th can book their second shot. Second doses will be available in the same sequencing as first doses were. And we will move quickly as possible down through the age groups, just like the first dose, based on our supply of vaccines. We will ensure that everyone will have the chance to get their second dose starting 13 weeks after the date of their first dose. It could happen even sooner than that, depending on vaccine supply. We will let everyone know when you are eligible through public service announcements and social media posts. And with the help of the news media, just like we have been doing in the first dose eligibility. Everyone should make note of when you got your first dose. That date is on your immunization card you received when you got your first shot, just like mine here. Or if for some reason you have misplaced your card and you can't remember that date, you can call the SaskVax line and they will provide that date for you. Scott and Derek are going to give you some more details about the second dose rollout in just a minute. But the most important thing is everyone needs to make sure that you get your second dose so you are fully vaccinated. And we will have an opportunity to do that very soon. Yesterday, Health Canada approved the Pfizer vaccine for everyone 12 years of age and older. This is great news, as it means another 91,000 young people in our province can now be vaccinated. We plan to offer vaccines in the schools before the end of the school year. Those detailed on the school-based programs, including the parental consent process and eligibility dates, are being finalized. And parents can anticipate a public announcement along with communication from public health and school divisions regarding the administration of the COVID-19 vaccine. That will come prior to the commencement of the school-based programs and youth eligibility. I'll end my comments by saying this. Vaccines are working. Today, our 7-day average in new cases is 216. That's down 24% from the peak of 285 on April 15th, 3 weeks ago today. As our vaccination numbers continue to go up, our case numbers should continue to go down. So the most important thing you can do when it's your turn is go and get your first shot. And if you're one of those 435,000 people who have already gotten their first shot, very soon you can start making your plans to get your second shot. After 14 long months, we are finally moving past the point of just controlling COVID-19. We're now in a position where we can beat COVID-19. But there's only one way to do that, and that's by everyone getting vaccinated. So thanks again, Saskatchewan. Thanks to everyone working in all the vaccine clinics, pharmacies, and our Indigenous services clinics around the province, vaccinating thousands of people every day. Thanks to the hundreds of thousands of Saskatchewan people who have already got vaccinated or will be doing so in the next few weeks. Thanks for doing your part. The end is in sight, but we have to keep going. So please keep following all of the public health orders and guidelines. And when it's your turn, and now it's when it's your second turn, roll up your sleeves and stick it to COVID. Scott?
Thanks, Minister. Good afternoon, everyone. I'd like to start by extending my condolences to those families of loved ones who they lost to COVID-19. The loss of every life is such a tragedy, and it's never far from my mind or the minds of all our staff and physicians at the Saskatchewan Health Authority. The need to do everything we can to promote to protect those most vulnerable remains strong, and that's why we're pleased to be here today to provide more information on the rollout of second doses of vaccine. We've already delivered more than 45,000 second doses to those individuals most at risk in our province. And in keeping with our commitment to ensure that everyone receives maximum protections, as the minister's already said, we're going to administer those second doses of vaccine well within the 16-week timeline that's recommended. And hopefully as vaccine supplies increase faster as we get farther into the program. Getting a second dose of any vaccine isn't something that most of us have had done since we were kids. But in this case, getting a second dose is critical to getting the very best protection against COVID for our province. We're nearly at the end of this thing, and every single one of us needs to finish this fight. I'm going to turn it over to Derek now, our Emergency Operations Center Chief, to present more information on the second dose plan and the youth immunization plan. Derek, go ahead.
Thank you, Scott. I'm happy to be here today to provide an update on our second dose strategy for vaccinations. The immunization campaign goals remain consistent with an objective to protect those most vulnerable, minimize serious illness and death, protect our healthcare system capacity, and minimize the spread of COVID-19. We do this by immunizing as many people as possible quickly and safely. An important part of achieving those campaign goals is through our second dose strategy. 2 doses of vaccines currently being administered in Saskatchewan. Pfizer, Moderna, and AstraZeneca are required for maximum protection. A reminder, and this applies for first doses as well as second doses, that once you're eligible, then you're always eligible. Saskatchewan has followed the National Advisory Committee on Immunization recommendations in terms of extending the interval out for second doses to 16 weeks after receiving the first dose. In order to ensure that all of those patients that have received their first dose receive their second dose within that 16-week window, we are going to open up eligibility for second doses at approximately 3 weeks after the first dose. This will ensure that we respect the 16-week interval. As we move forward and as vaccine supplies increase, our intent is to shorten that interval from 13 weeks down to the manufacturer recommended minimum interval between first and second doses, which is 3 or 4 weeks, depending on vaccine type. And again, as we roll through that, our intent is that we will have opened up the system and offer second doses based on those manufacturer guidelines by the 31st of July. The only exception to all of this, of course, is the Janssen vaccine by Johnson & Johnson. It's a single-shot vaccine. Currently, we're not yet administering this vaccine in Saskatchewan, although we are expecting that in the coming weeks. What will notification look like? Our second dose roll down will be offered in the same sequence as first doses. Eligibility will be driven by age or on the date of your first dose. And as an example, when we start moving forward with the strategy on the 17th of May, anyone 85 years of age or older, or anyone who received their first dose before the 15th of February would be eligible to book in and receive their second dose. Of course, during this transition, we will be offering second or first doses to those that haven't had their first dose yet, as there is some overlap as we move forward between the two doses. How will you know if you're eligible? The minister showed his immunization card that has the date on it. Would be the primary way for you to see when you got your first dose, and therefore when you would be eligible to get your second dose. You can also access that through immunization history on your My Sask Health record account. Pharmacies are able to look up when you received your first dose electronically. And if you're unsure, ultimately, you can always call the 1-833 SASVAX call center for assistance, and they can advise you when you received your first dose and also indicate whether you're eligible for your second dose. Similar to how we've rolled out notices about eligibility so far in the campaign with first doses, we will be following a similar path and sharing that information in government and SHA news releases, as well as public service advisories. There are a few subgroups within the clinically extremely vulnerable that are being prioritized for second doses, and those include organ transplant and oncology patients. They will be able to book in for their second dose as soon as we launch the strategy the week of the 17th of May. And as well, the patients on rituximab medication, they're actually eligible now as long as they have reached the minimum interval of 4 weeks since their first dose. And letters will be provided to all of those patients that fit those categories. Otherwise, the clinically extremely vulnerable will follow the same sequence as the rest of the second dose strategy. Where will I get my second dose and what brand will I receive? This is a common question that I think is on everyone's mind. The current guidelines recommend that your second dose should be the same brand as your first dose. The pharmacies, the SHA online booking, as well as the SASVAX phone line are all here to help patients ensure when they're booking that they do get the same vaccine brand, and they're able to support that throughout the booking process, as well as when you actually access your vaccine through one of the clinics, the drive-throughs, or the pharmacies themselves. So they'll make sure that you're able to select the right vaccine type, the right brand, by advertising that at the sites beforehand. So people will know what vaccines are being provided at which clinics to ensure that they get the same dose for the second dose. Key messages for today as we focus on finishing the fight. You aren't fully protected against COVID-19 until you've received your second shot of vaccine, and this is so essential to finishing this. The eligibility for your second dose, it starts 13 weeks after you received your first dose. And access is the same as the first dose, and that could be through multiple ways, such as drive-thrus, pharmacies, book appointments in clinics, as well as the mobile teams that have been delivering first doses across the province. So please check the date of your first dose on your immunization card and watch the government and SHA communication channels and for when you will become eligible for your second dose. And I'll turn it back to Scott.
I think that's it, Matt. So we're open for questions now.
Thanks, everyone. We'll start with questions in the room. Lynn?
Yeah, so starting eligibility at 13 weeks after the first dose, are you confident that will leave enough time? Like, we know that often appointments have been booking 2 weeks out. Like, that doesn't really leave a whole lot of room for error.
I'll touch on that, and maybe Scott can finish off. Because we're going to move through that second dose very quickly, it's going to go, projecting about 6 to 7 weeks would be our second dose time frame from start to finish. So understanding that we are going to be finishing off first doses and starting second doses almost at the exact same time. So we're hoping to make sure that that is sooner, but we're well within the 16 weeks that NACI is recommending. Dr. Shahab or Scott, did you want to?
So I'll if I could, Minister, is Lynn, the 13-week time frame was chosen to ensure that we would be able to vaccinate all of those individuals eligible within the 3-week time period before they hit that 16-week mark. And we have been tracking those numbers and the number of individuals eligible since the beginning of the immunization program. We know that we will have all the capacity that we need to deliver those vaccines. If for some chance that somebody doesn't get within the 16-week window, it's not a life or death situation, but it's just not ideal. And certainly we will be able to vaccinate them shortly thereafter. But it's the reason we're backing it up 13 weeks is so that we can guarantee we have enough time to actually get those people through the clinics with the vaccine that's available to ensure that they get their second doses as quickly as possible.
Follow-up question, Lynn?
Yeah, like, are there concerns about people getting the right kind of vaccine, especially because AstraZeneca and Moderna deliveries have been Moderna especially has been kind of hit and miss, and the doses have been lower? Like, are people for sure going to be able to get the dose that they need to?
We're certainly working with our federal counterparts. I've made this aware in a conversation to the Minister of Health, the federal Minister of Health. This is a concern, and it's not just a concern in Saskatchewan, it's across the country, to make sure that we have the second dose vaccines ready, that we have Moderna and AstraZeneca on hand. We're still waiting for confirmation of AstraZeneca, but the federal government has assured us that it shouldn't be a problem, that they will have more vaccines in May and June than we've ever had. So,
Take a question. Next question from Mark.
Is there any concern that starting second doses now is going to slow down the process of getting first doses out into people's arms?
No, Mark, we're looking at dialing down the first doses because we're going to be in that range right around the middle of the month where we're getting into the younger age group, but we don't want to lose any momentum. So, and again, we want to keep it to that 13 weeks. So we're going to make sure that it doesn't impact the first dose, but there will be overlap just because we're getting more vaccines in the middle of the month, which will allow us to do both at the same time.
Follow-up question?
With this, you said a lot of the school rollout is still being worked on.
Mm-hmm.
Is there any more you can tell us about how that's going to work? And is there any thought to doing it sooner than near the end of the school year to ensure that those students are protected?
Well, we looked at a few things. We looked at obviously the high school kids will be, the high school youths will be in exam time. So we wanted to try to get it in before that time, just because it's going to be logistically important in the schools to make sure that we're not causing too chaos in there. But we have had programs that have run in the elementary schools over the years with vaccination. So we're just transferring that same knowledge that we have in the public health vaccination in the younger years to the older years. We're going to work with the health people within education and also complement that with our mobile clinics to go out there to reinforce so we can get it done in a very short manner. But we'll be announcing more details on that in the coming days.
We'll take a question on the phone lines.
We have Lisa Schick with CJME.
Hi. How much do you know about AstraZeneca shipments on the horizon? Do you know if we are going to be getting more, and how is that going to affect the second dose rollout? Are people going to have to be waiting longer and longer?
No, Lisa, the anticipation is we're going to get this. We haven't any confirmed shipments through the federal government, but the federal minister has assured myself and the other health ministers across Canada that we will be able to get that AstraZeneca in as soon as possible. So we're confident in getting that done in a timely manner to make sure that somebody does hit in and around that 13 weeks. We haven't got anything finalized by the federal government, but we're cautiously optimistic that this will come in time.
Follow-up question, Lisa?
Yes. I mean, all kinds of things can happen, right? There could be something that happens with a transport, something that happens at a factory. So just wondering how many people, at what point do you say, okay, we'll give people a different vaccine, and will you be able to say that if the data on that practice isn't back yet? Because I know there's a study on that happening.
Yeah, absolutely, Lisa. And unfortunately, we've had to deal with this in the first dose where we've seen missed shipments. We've seen shipments cut in half, delayed. We've seen it. Well, I don't want to say we've seen it all, but I hope we've seen it all. And the federal government has worked out and streamlined a lot of the delivery processes. So that's why we're getting more vaccines right now, and they seem to be coming in more consistently. So we're very hopeful that we will be able to match up what you got on the first vaccine to your second vaccine. If there is something wrong with a shipment or something is delayed, then we'll make that assessment at that time. I don't know, Dr. Shahab, did you want to comment on that?
Yes, thank you, Minister. So that's exactly true that at this point, we expect that there'll be second doses matched to first doses that were given. And because AstraZeneca started middle of March, 3 months don't happen till mid-June, and of course 16 weeks don't happen till mid-July. So there's plenty of time. But of course, if there's any issues with shipments of specific vaccines, we are actively looking at mix and match schedules to use if required. And in the past, other places of Canada have had to use that. And we will certainly have information when required, whether we can wait a bit longer for second doses to be the exact as the first dose, or whether mix and match is required. And I have to say, a lot of this also depends on community transmission. Till such time that all of us are vaccinated, we must do everything we can to keep our transmission rates low. And I'll just mention briefly that even if you look at our COVID cases of the last 7 days, and the Minister mentioned the impact of vaccinations, less than 10% of our COVID cases were in people over the age of 60. And that speaks to, high vaccination rates. And then about 25% of our cases were in 40 to 59 COVID cases. So obviously 40-year-olds, 50-year-olds, we need to learn from our seniors and really ramp up our uptake. And then about 67% of COVID transmission was, so 37% of COVID cases were 20 to 39. So again, people in their 30s can now book vaccines. So please roll up your sleeve, get vaccinated. And then once it's open to people younger than 30, don't delay, get vaccinated. The supplies are there. And certainly the fact that 30% of COVID cases were in persons under the age of 20, I think the fact that we can vaccinate not just 16 and older, but 12 and older ultimately over May, June, I think is excellent news. So again, the more quickly we all get our first doses, and then 3 weeks later, we substantially reduce transmission, both in terms of risk to ourselves and to those around us, especially children under 11 who remain unvaccinated for the time being. And then, of course, second dose is starting concurrently. So just want to emphasize that right now the emphasis has to be on getting first doses as quickly as we can, and of course keeping an eye on when we become eligible for second doses. Thank you.
Take another question on the phone line.
We have Adam Hunter with CBC.
Thank you. Based on, I think Dr. Shahab just mentioned it, but based on uptake we're seeing right now, what are we anticipating as far as percentage of people who will end up getting a first dose? Do we have any sense of that, how high it could be, or if we need to increase our efforts to get people out to get a first dose?
Maybe I'll start on that. I think, ultimately we would like to have everybody vaccinated. The higher the number, the better it is for our communities and for our families and for our livelihoods. So 70 is the threshold where we wanted to be able to determine when we could start removing some of the restrictions, but that doesn't mean that that's the ceiling. We want to get up as high as 80 or 90%. I think if we can learn a lesson from our seniors where they were well above 90% and everybody can achieve to do what the seniors have done in this province, I think this province will be faring extremely well in regards to COVID.
Dr. Shahab, did you want to weigh in on that as well?
Yes, thank you. And I would just say that, like I said earlier, from what we have heard, there's a high interest in getting vaccinated across all age groups because it promises all of us a return to normal. And if all of us get vaccinated, the quicker we get vaccinated as soon as we're eligible, the quicker we can return to normal. And that is part of the reopening roadmap announced on Tuesday. And the second thing is, like I said on Tuesday, how privileged are we that although it is a slower start, but we are one of the few countries in the world right now where everyone 12 and older will be eligible to get a vaccine in May and then in June. And, to deny this privilege and let COVID continue to affect our lives and livelihoods and social interactions, would be pretty unfortunate. But certainly, from all what I've heard is that there's high interest. The bulk of the vaccines coming through are the mRNA vaccines, highly effective, highly safe, and I think we just need to be ready to just make that booking or go to that drive-through as soon as we become eligible. Thank you.
Adam, do you have a follow-up question?
There's questions for Mr. Livingstone or Miller or Dr. Shahab or all. What's the situation in the hospitals right now? We know about a month ago there was a lot of concern about Regina ICU specifically and being over capacity. With the numbers dropping, as far as cases go, hospitalization seems steady. What can you tell us about the current situation in hospitals and specifically ICUs?
Well, I'll start and maybe Scott can touch on this. I think we've seen a downward trend in our hospitalization in our ICU, and that's directly correlated to adhering to the public health measures and getting vaccinated. And the amount of vaccines that we've done in the last few weeks have certainly helped out in driving those numbers down because we know the vaccines, even one shot, will severely help you in making sure that there are no severe outcomes. So the vaccination numbers are critically important, but also the great work of the healthcare people and the staff, the frontline workers out there to make sure that if somebody does come in contact into the hospital, that they're getting the best care that they possibly can and making sure that they're getting the treatment and ultimately getting them healthier and moving them back into their lives.
So Adam, it's Scott. Just add to what the minister has said. As you know, we still continue to see hospitalizations for COVID and still caring for those patients who are non-infectious and infectious both on inpatient beds and in the ICUs. Particularly in Regina, we are seeing and provincially a downward trend in the daily cases. So as you know, hospitalizations are a lagging measure of what we're experiencing COVID. That said, it's always important for folks to remember that it's not just the COVID patients that are putting pressure on our acute care system and our providers across the province. We're still seeing people coming into emergency and into ICUs for non-COVID related illness. And that's the other thing that we've always been keeping a close eye on as we build surge capacity. So in particular in Saskatoon, We're not seeing, the highest numbers of COVID patients in the ICUs or the facilities, but we are seeing pressure on the ICU in Saskatoon today, but that's non-COVID related to non-COVID patients being put into the ICU. So again, looking at all options available to us with respect to load leveling those caseloads in other areas of the province. It's one of the advantages of having the SHA is we can use beds to provide appropriate care to patients when it's available, but we are still seeing significant pressure on our acute care system, and we are watching it very carefully. Both the Premier and the ministers have often said as we move through this next phase of our experience with the pandemic, we've got a close eye on hospital capacity. It's one of the most important measures that we're looking at.
We'll take another question on the line.
We have Julia Peterson with the Canadian Press.
Hello. My question is related to younger children. So we now have the authorization for children 12 and over. Can you give me any update or any sense of when younger children might be able to be vaccinated, and when that does happen, what the procedures or systems in place for that might look like?
I'll get Dr. Shahab to comment on that.
Yeah, thank you for that question. So we fully expect, there are trials ongoing in children under 11, and we fully expect those trials to be very positive in terms of both the safety and effectiveness of vaccines. And it's true that, with all vaccines, we look at the entire population being vaccinated to protect all of us. So we fully expect by July, August, we'll have information on the effectiveness and safety of vaccines in children under 11. We will have approval by Health Canada, and which products will be available for children. It depends on which companies have done the trials. We don't expect them to be very different from the vaccines that are currently available. And of course, public health already does the bulk of its vaccinations in children under 5, and both public health and pharmacies and physicians already vaccinate children of all ages for vaccine preventable diseases. So the capacity is there that as soon as vaccines are approved for children under 11 and vaccines are available, that would be an easy thing to implement, even during the holidays, but especially once school starts. A lot of childhood immunization programs are either preschool or in grade 6 and 8. School-based programs could easily address childhood immunizations if that happened in September. But certainly if the recommendation and approval by Health Canada and the vaccine was available for children under 12, even over the summer, that should not be an issue.
Do you have a follow-up question, Julia?
No, that answers it for me. Thank you.
We'll take our next question on the phone line.
We have Roberta Bell with Global.
Hi, my question is regarding the second dosing strategy for youth. If the first dosing strategy relies so heavily, obviously, on school-based programs, can you tell us a little bit more about how the sequencing is going to work for their second dose in the summer when schools are presumably not operating?
Well, there'll be two things. Is obviously they'll still be eligible either to book an appointment with a family member or come in and get that second dose, or if they're done in early June, when they come back to school in early September, it'd still be well within that 120 days, and they can receive their second dose. And so there's a few options. Obviously, we would encourage anybody to come in, the youth that are getting done in that 12 to 17. If they hit that 3-week time and there's spots available on our second dose, I'd encourage them to get in and get fully vaccinated immediately, not wait till the school year. But there are a couple of options there that we're looking at.
Do you have a follow-up question, Roberta?
Sure. Just wondering about that school comment, because that would mean that everyone wouldn't theoretically be offered that second dose by July 31st as per the slide. And I guess why isn't the reopening plan looking at second doses, since the messaging seems to be we aren't fully protected without a second dose?
Well, you're absolutely right. We are fully protected once we are fully vaccinated, which is a second dose. What we've been looking at is the metrics of what have been happening around the world in Israel, the UK, and the US. As far as that 70% threshold, that seems to be on the first dose when the hospitalization's lower, the ICU cases lower, and we see case numbers lower. So that's why that is tied to the first dose. The second dose is absolutely critically important, but we wanted to make sure that we have a very balanced approach to opening things back up. That's why we have our thresholds at that 70% and we wait for 3 weeks. So that first dose has time to take effect and get fully into your system. Then the same thing with step 2. So it's a very staged out approach. I don't know if Dr. Shahab wanted to make any comments on that.
Yeah, thank you. I think that's a really important point. And like the minister said, we still have to comply with all the current public health measures. Still, we are ready to enter step 1. And then there are very specific guidelines that will continue to be in step 1, some relaxation, but all the other guidelines will continue and we need to comply with that. And same with step 2. And then once we reach step 3, obviously there'll be an assessment, likely, early part of July about what our case numbers are and what are some of our hotspots, and based on that, what further measures can be relaxed, especially around gathering sizes and indoor mask use. But I have to emphasize that, children under 12 are not independently social, so they are protected by high vaccine uptake in parents and siblings who are older. And the higher our first dose uptake is, and then very quickly our second dose uptake is, the more quickly we can start relaxing public health measures. So it's working in tandem. The higher our vaccine uptake goes, first dose, and as we heard today, very quickly second dose, the more easily we can start relaxing public health measures. But if we start relaxing public health measures prematurely, or if people stop complying, I think we have all seen throughout Canada and even in Saskatchewan how quickly COVID can come back. And I think we just need to be recognize that and be patient with public health measures and do the things that we have been doing all along. Like the Premier said, it's not an on-off switch, it's like a dimmer switch, that as the dial for vaccine uptake goes higher, we can start, relaxing public health measures in a systematic way. And that was the intent of the roadmap and all the metrics that will inform the roadmap to reopening. Thank you.
We'll come back to the room for a couple more questions. Lynn?
So with the 12 and up, are they just going to become eligible as we move down that age-based system, or are they just going to once we hit 18, it'll just be 12 and up everyone?
I think there's a pretty good chance we'll open up the whole age category at once, but we just got to see based on vaccine supply what comes in.
At what point would that open to everyone potentially start?
We'd have to look. Right now we've dropped almost a year a day in the last little while, so that will continue to go. There's 91,000 eligible people in that category that we just opened up from that 12 to 17. So we want to make sure that that's done in a controlled way. That way, that's why we're targeting inside the school system, because it's easiest to access all of these youths.
Mark?
Is the step 3 of the reopening plan going to now be 70% of everyone 12 and up, or is it going to remain 70% of adults?
No, it'll remain at 70% of 18 and older. Yes.
Also, is there any plans to have the Regina drive-through open after today? I know it was scheduled to close after today, but is there plans to have it open this weekend?
We're working on it, but again, we've allocated a large portion of our vaccines that we received this week out to the pharmacies, which is going extremely well. We have our booked appointments. If there's an opportunity, if we get a shipment in early, we're hoping that Johnson & Johnson comes in early. If that comes in, we will certainly open up both Saskatoon and Regina immediately, because we get great response from the communities that are going through those drive-through. Even though they're a couple-hour wait, people are very excited and very encouraged to get their vaccine right away. So as soon as we can, we'll get them back open. Absolutely, Mark.
Is that where Johnson & Johnson vaccines would be going? Is Regina and Saskatoon drive-thrus?
We haven't decided that yet, but we were looking at it.
I can slide in one more since we don't have a lot of time. With second doses starting as we're finishing up first ones, especially with the elderly getting fully vaccinated, is there a chance clinics or pharmacies would be prioritizing elderly people for second doses over younger people coming in for their first dose?
It's going to happen simultaneously. It's going to be probably overlap. We'll allow the pharmacies and those to make the decision on their own. Right now, the pharmacies are doing an extremely good push through of what we're doing with the vaccines. So it's going to happen so quick, Lynn, that it'll only be a couple of days overlap with the seniors. But obviously, we want to get people fully vaccinated. That's the most important priority. And I'm sure the pharmacies and all the booking systems will be doing that. And we'll make sure that the seniors have their first shot at getting their second dose and fully vaccinated, if that makes sense.
Perfect. Thank you, everyone. That concludes today's availability.